Why is it that not all doctors in all hospitals in the world are offering Birmingham hip resurfacing?
Well, this BHR, the Birmingham hip resurfacing, we were one of the first to start in the world. I think, if I'm not mistaken, 5th or 6th center in the world to start off back in 2000. So we have a long experience with it. Other hospitals all over the world are now starting both in India and abroad. And now they have less experience. Obviously, we have more experience. And complex cases like him, he had a very complex hip problem. Almost his hip was fully fused. And so for complex problems, only there are very select centers in the world that can handle it at the moment.
Are there any other hospitals in the world that offer this?
Yes, there are centers. It was invented in Birmingham in the UK, which is remains to be a center that attracts a lot of international patients. There are some things in Belgium and Australia, but price-wise we are very competitive. And for complex cases, there are a lot of complex hip pathology in Asia. So we personally have a lot of experience in complex cases. So we draw complex cases, and for patients who are actually looking for a good deal on the financial side as well, we seem to be very attractive.
How many surgeries have you done here in Apollo?
Here in Apollo, I've done just over 1,200 of these hip resurfacing surgeries.
And, every month?
Yeah, I do about 30 to 35 every month now.
And do you get a lot of international patients?
Yes, now initially we used to get only from the US and Canada, but now it's been truly a global profile. We have a lot of patients from the North America, we have from Russia and its neighboring countries, we have from the Middle East, we have from Australia and New Zealand, we have from our neighbors, and truly it has become a global profile now for patients.
Is there an increasing trend of international patients coming to India, to Apollo for BHR?
Yes, I think there's an international trend for India as a whole attracting patients. Apollo has been in the forefront, I think one of the first hospitals to attract patients. But in the hip surgery unit here, we have had a progressive increase over the years. We started getting around 2003, we started getting international patients, and over the years, more and more patients are coming. At the moment, I personally do about 12 to 15 overseas patients. That's we're talking only about patients from developed countries. We have a lot more coming from the Middle East and neighboring countries, but from the developed countries, we have about 12 to 15 every month who are coming. And with the recent recession and things in the US, we expect more patients.
How do you decide, who is the ideal candidate for BHR?
Well, there are three factors that we take into account. One is the age, the two is the activity level, and three is the bone stock. So somebody like Benny, who's very active, was playing for his national team in soccer, that's an ideal candidate. So he cannot be that active now just because of his hip problem. So we sort out the hip problem by doing some device which all these activities are possible post-op, then we put him exactly where he belongs. So he's a sort of ideal candidate. Must be relatively younger, very high activity level, good bone stock, and they are the ideal candidates for this procedure.
What would be the recovery period after surgery?
Recovery period is remarkably different from conventional hip replacement. Conventional hip replacement, we're always worried that the joint may dislocate, so we keep them very slow for a long time, probably 6 weeks we keep them off any activity. But here, the next day they're walking, and he's only about 7-8 days from surgery, and you can see how mobile he is. And we have no restrictions post-op. We can do whatever they want, and as soon as they're comfortable sitting on the floor or anything, whenever they're comfortable they can do. And usually we advise swimming at about 3 weeks. That actually rehabs the hip very well. And all sorts of sports, inclusive of contact sports, is possible at about 6 weeks from surgery.
Can you explain what exactly is BHR and
right, okay.
Advantage as against a traditional hip?
Right.
surgery?
So this traditional hip replacement we have been having for the last 50 years or so. This has been very good for the elderly inactive population. Has been benefited very well from this. But however, younger people like Benny, when they are hip arthritis, this conventional or the traditional hip replacement just was not the answer for them. This is how a conventional hip replacement looks like. Now the problem with the conventional hip is that we take this normal sized ball off from the ball and socket hip joint, and we put this small ball of the conventional hip done. Not only that, we remove good bone. Young people have good bone. We remove this good bone and actually discard it, which is a great pity in my opinion. Whereas this is okay for somebody who is elderly inactive, but in more active patients, they dislocate the joint, but more importantly, they wear it out very fast. So after this surgery, we tell patients not to be very active. It's a bit of a paradox, because the whole idea the patient came to you for surgery was because they couldn't do so many activities like football, but then we do the surgery and tell them you should not be active as well. So younger patients are not very happy with this surgery. So now we have this Birmingham hip. This is how it looks. So it's dramatically different from the traditional hip replacement. Here we don't remove any bone. you just put a cap on the bone. This cap comes in 12 sizes, so the patient will get a very natural size at the joint. It's fundamental to give back full function. On the other side, instead of using plastic, we use a metal shell like this, which will go into the socket like that. Okay. So once it is done, it's just like a normal hip. So they can do all activities with this. They can do impact activities. They can run, jog, jump, and play football, for example, do martial arts, do horse riding, skiing. So it's been really a boon for younger patients. It's been really a boon for younger active patients, and they're able to regain their normal lifestyle, which I think is crucial. And these days, patients want to do much more post-op. Earlier pain relief was the only goal, but now pain relief is not the only goal. Pain relief is very important, but apart from that, we want to put the patient at a very high activity level that they were used to before surgery, and therefore this seems to be the solution for the younger active patient.